Okay. Your patient takes 150 milligrams of a medication daily. But unfortunately, the pharmacy or in your medication, you only have 25 milligram tablets, not tables. We do not give out medications in tables, but in this instance, I guess we're giving it out in tables. That's okay, right? How many? What you don't understand, this was crazy. Let me just tell you this. And Mary Ann, if you laugh at me, I'm going to like chop your head off. She is the most computer literate person. I am not. So in my office, the day before this presentation was due, there became a rain shower from a toilet up above. It was from heaven, I feel sure, right? You know. And so, of course, it went on my computer, and my computer just sort of like shot fire out of it and other things. And what I didn't understand is if my home computer is not up, I can't do anything. I can't remote into it. I can't do anything. And so I am going crazy now. I cannot, and you know, I have an iron key, but I can't it's not saved on my iron key. So I just sort of kind of went crazy, and I typed this very rapidly on my laptop, and it was pretty. Then I emailed it to her, and it was pretty at the last minute. So typographical errors are my fault, and I do apologize. So we got it done by the grace of God, and that's all I'm going to say. All right. So your patient takes 150 milligram tablets, but in your cabinet you only have 25 milligrams. All right. So let's set this up. What your doctor ordered was 150 milligrams, right? What your tablets you have on hand is 25. So as x over 1, let's cross multiply. 25x equals 150. So basically what we're going to do is we're going to divide each side by the number in front of the x, and so we're going to come up with 6. We're going to give this patient 6 tablets. So when we come back here, we're going to tell our patient to take 6 tablets once a day, right? Y'all okay with that? Okay, all right. All right. What your physician has ordered is 80 milligrams of Solu-Medrol. I am right now, right? You have 40 milligrams per milliliter, and you have 125 milligrams per milliliter. That's all that you have available. You have 40, and you have 125. Well, which one should you use? Guys, I would start with a smaller, and I would work up, all right? So what we're going to do is what your doctor ordered was 80. What we actually have is 40. So the doctor ordered 80 over what we have on hand is 40. And so now we're going to put over x, because we don't know how much that's going to be, over 1. So then we're going to have 40x is equal to 80, or it's going to be 2 milliliters. Okay? All right. I want you to know that your packaging, basically, everybody who packages medicine for you, whoever you get your medicine from, packages it for your convenience, right? So when you go to the medicine cabinet and you have to pull out a whole lot of pills, like we did in the problem just before that, I want you to stop and think. A red light should go off and say, is this possible? I mean, is this right? Go ask somebody else. Would you please look at this and make sure I'm figuring this out right? So I was orienting a new person one time, and the doctor had ordered an order for Valium 50 milligrams. And so she went to the med station, and she started getting out multiple vials of Valium. And I said to her, what's the normal dose of Valium? And she said, I don't know. And I just sort of looked at her, and I said, you probably want to look that up, right? And so she said, okay. And she looked it up, and the normal dose of Valium was 2 to 10 milligrams. And she said, but the doctor told me 50. And I said, well, do you think you need to call and verify the order? Which she did. And the physician said, oh, honey, that's 5. You just can't read my writing. So if there's any chance that you feel uncomfortable with the order, then please, please, please ask somebody, okay, to see what's going on there. All right, let's go to the next one. Okay, the doctor has ordered the 80 milligrams of Solu-Medrol. So we put 80 over 40 equals x over 1, and we're going to give them 2 mLs. All right? All right. If we choose to use your 125, let's use your 125 milligrams per milliliter. So here is your 125 over 80, which is what your physician has ordered is 80, right? over x over 1. So we're going to cross multiply, and we have 80x equals 125. Divide each side by the 80, and you come up with x is equal to 1.56 milliliters. The difference between the two is that this solumedrol is more concentrated than the other solumedrol. So you're going to actually give less of that than you are of this one. Y'all okay with that? You understand those two? Okay, all right. Questions yet? Okay. The provider has ordered a cough syrup that comes in 125 milligrams per 5 mLs, right? He wants the patient to take 375 milligrams every 8 hours. How many milliliters should the patient take? What the physician has ordered is 375 milligrams. So we have 375 milligrams. My little mouse doesn't do like Mary Ann's. Hers just like makes little circles. I'm pretty jealous about that. You'll see in a minute. And then what it comes in is 125, right? 125 milligrams in 5 mLs. We don't know how much 375 milligrams would be, so we put an X. So let's cross multiply. 125x is equal to 375 times 5. Here's your 5 right here. So we have 125x is equal to 1875. You divide each side by the 125, and you come up with 15 mLs. That's a lot of cough syrup. So that is how much? How many teaspoons is that? 3. Good. 3. All right. Back here, I am a firm believer that as we get older, that we use up our rote memory. We just don't have any more cards. We don't have any more drug cards in our brain that we can flash through. Please take this. I don't think that you should have to memorize anything that's written down. And I feel very strongly about that. Take this, post it inside your cabinet. You don't have to remember any of this stuff because it's written down. But unless you know it, then you can always refer back to it. I know that's really quick and simple, but if you just keep that as simple as it is, that's the way I learn cross multiplication. Do y'all have any questions for me at all? No? Thank you.
Hey guys, can everyone hear me okay? I'm Cassidy Bass. I'm one of the trainers at eChart. Mary Ann is with me. She's one of our senior instructional designers. We both do all of ambulatory, us two. And if you've come through training the past 10 months or so, you've probably seen me around. But today we're going to be talking about documenting the medication administration in eChart, which is very important. It's just as important as administering it correctly. It needs to be documented correctly. So today we'll discuss reconciling the medication from outside sources, documentation of medication review, documentation of CAMs, which are clinic-administered medications, documentation of sample medications, and documentation of immunizations that you administer within the clinic. Okay. So the first thing that we'll show is medical reconciliation. Unfortunately, our training environment, we do not have this built out, so we'll just look at the slide for this one. But what this is, and there's a photo or a little picture screenshot of it, it's the red bar. So when another source has a medication on file for the patient, a red banner will appear across the top of the medication section. So this data can come from multiple different places. It can come from other organizations that may see the patient. It can come from the patient's pharmacies, and it can even come from MyChart, where the patient has put that in themselves. So what you would do with this is in the medication review section of the rooming activity, and I know you guys spend most of your time in the rooming activity, if you see this bar, anything in Epic that's red, it grabs your attention. So it will say that there are new medications from outside sources and medications need attention. So you will just click that button with the blue arrow that says Go Reconcile. So is everyone familiar with that? You probably see it quite often. Okay, so then you would review the information that appears in the Reconcile Outside Info activity. So you may add or discard medications by using the appropriate speed buttons, and they look like these right here. So any medications that you discard, they will fall off the list. So you can discard any duplicate. So if there's a duplicate med on there, you can just go ahead and discard that. But all other medications that you add will appear for the physician to review. So you can add any of those medications, and the physician can then come in and clarify. When you're finished with that, you will have to click the Accept button. It has the little green check mark next to it, and you're used to clicking Accept a lot within Epic. Epic likes its Accept buttons. So when you're finished, you'll just click that button, and that reconciled medication will go into the patient med list, and you'll go back to that medication review screen. Okay. So any questions on medical reconciliation? So this screen just says that it's very important for patient safety, and you may also see these banners within the allergies problem list or immunization activities as well, that you can reconcile that information. So it will look the same, it just may show up in allergies problem list or immunizations. Okay. Okay, so medication review, and you guys are used to doing this also, I hope. So within that rooming activity, in the medication review section, you will see the med list for the patient. So what you should be doing is going through every one of those medications and asking the patient whether they're taking their medication, how they're taking it, and you have the option, and you can see in the screenshot that you have speed buttons that you can click whether they are taking the medication, if they're taking it differently, not taking, or unknown. If you choose that they're taking it differently, you'll get, and I'll show you just in a minute, you'll get options to document how they're taking it. And then if you notice in this screenshot down here, that information highlights in yellow. So it will stand out for the physician to view and address. So that's extremely important that you do that and you go through that with the patient. And I'll go ahead and show you real quick within Epic what that looks like. So I'm just going to double click on my patient, and I'll automatically go into the rooming section, and you can either scroll down. I'm just going to click on the medication review, and I would go through all of these different medications. So I'm going to say that the patient is taking this, and you can say on this one that the Percocet, they're taking it differently. And then whenever you click that, you'll get the additional information that it wants you to fill out. So you could say that, I'm going to say this patient is supposed to be taking it every 6 hours as needed, but they're taking it, I'm just going to throw something in there, every 4 hours. Okay, so that may be important. That's important for the doctor to see. So I'm going to accept that. And if you notice that it highlights in yellow, that not only that it says the patient's taking it differently, it also lists how they are taking it differently. So that then the physician can go back and they will, just real quick, I'll show you in the plan, the physician will see this also in the plan. So it doesn't, they don't have to go into the rooming activity, find that med list. They will see it on the plan also in the meds and orders section. Okay. So what questions do we have about med review? Do we have any questions?
I was always told we're supposed to mark who the informant is if it's a parent or if it's the patient themselves. And I get a lot of patients that say as needed, and then when I ask them how frequently to use it, like it's something like Tylenol and they have it in their cabinet, they use it once a week, and of course they're still, taking it, but there's some people who have like an albuterol inhaler, they haven't used in 6 months, so we want it on the list because they might use it, but they're not really using it, so it's not in their system. And in that situation, I've been told that you're supposed to mark that they're not taking it currently, because it's not something that they're currently using, but they have it just in case. And so if it's something they've completely finished treatment on, then we mark it as treatment completed, and then it takes it off of the list completely. But if it's still in their cabinet and they might use it, like some pain medications, doctors have said don't take the pain medications off because they might use it. But if the patient's saying they're not having to use it, that is good information for the doctor to know how they're feeling if they're not feeling like they need to use the medication.
Yes,
So
and
I just wanted clarification on that, because that may be just
okay,
per clinic, or I don't know if it's.
okay, gotcha. So
You'll need to repeat the question so that more.
okay, okay. So the first question or comment was about the informant on the medication review. You do have the option, if we said that they're taking it differently, there is a, it will open up and say the informant, you can choose whether the patient stated that or the spouse or significant other, so you can add that information in there. So you also have the option to click to add text, and you can add any of those, any comments or instructions. Also, you also have another box that says what's the reason why they're taking it differently, and it's not letting me.
Just put in the regular comments.
Okay, so we can put it in this section. We can put any comments, like you said. You can just free text that in. Oh, there we go. And if you choose that they're taking it differently, you have the option to enter a reason why. So you could choose that it's not effective or side effects and add a comment there. So you have the option to add all of that information in there. So if they are just, they're not taking it now, but it's as needed and they may take it in the future, you can add that in there. Okay? We have any other questions?
The part about the as needed, when they're always saying as needed.
Hold on just a minute. Pain medication, for example. Oh, hey. Yeah, I get a lot of patients, they're in a hurry, they don't want to sit there and take the time to go over their medication lists, even though it's incredibly important, especially with little kids. But they'll just say as needed, as needed, as needed. And I'm like, okay, you need to slow down just a sec. Let me know how often are they taking it. Like sometimes they have like a hydrocodone they were prescribed 6 months ago that they still have, but they haven't been taking it for over a month. So it's not in their system. The doctor needs to know they're not actually taking it still, but it stays on the list and we just mark it as not taking because it is something that they have on hand as needed. Or like an albuterol inhaler, rescue inhaler or something, if they still have it and they might use it, but they just aren't using it. And I didn't know because I've been getting instruction from like my doctors, but I don't know. I've seen so many different variances when they come in from other offices, and that can be kind of frustrating because they're just used to saying as needed and they just mark everything as yes.
Gotcha.
Even though there's like 5 of them on there they haven't taken in 6 months. So
There's no additional information
Right.
in there that they're
right, and the
documenting.
thing, it just shows that people have just been checking yes, 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 yes,
So,
Something else to point out too, and it's not on this screen, it's under the plan and the medications there. Those things like your rescue inhalers, they should be marking those as long-term. Hold on one second.
You're right here.
Okay. If they mark them long-term, it'll put a little push pin on it. That means that it'll still stay on their med list, even though they're not using it. So it's those, many times, those special creams that they keep on hand for something, those rescue inhalers, pain meds that they only take when they have a flare-up of something, whatever else you might be using a long-term med for. But also for the PRNs, but also for their everyday meds. You know, you're on Synthroid usually for the rest of your life. That should be a long-term med, your blood pressure medicines, so they don't accidentally fall off. If somebody puts an expiration date on something, you should, the doctor should get in the habit of doing that as well. But you can do that as an MA or a nurse as well. You can mark them as long-term meds. Did we answer all your questions on that one?
I mostly just wanted to make sure I wasn't doing something I wasn't supposed to be.
No, you're fine. What you're doing is fine.
Other people know that maybe weren't instructed by their doctors or office.
What you don't want to do is discontinue a med off of a list. We don't have that within anybody's credentials, okay?
I've been told by the nurses
We,
I'm supposed to take
if,
certain things.
if it's been an antibiotic that was a, 5-day course and it was from a year ago and it never came off, you're not discontinuing that med. It's already been discontinued. You're just taking it off that med list. But if the patient says, oh, I haven't taken that in a while, it's not up to you to take it off that med list. You just need to mark it as not taking. Okay? And just while we're on the screen, everybody knows the difference in all the little icons. The house icon is their meds they're taking at home. We're going to use the Toradol in a minute. We added that to give as a clinic-administered medication. If there was a little man with a bubble, that shows up if the patient says they're taking something else. For instance, some ibuprofen. And again, you can just completion match there, type part of it, and it fills in. And now you've got the man with the bubble. Just so you remember your icons. If you ever see something with a bed icon that your provider has ordered, those are meds for in the hospital and they're in the wrong area. Or if your doc's trying to call in an order for a patient in the hospital, they can't do it from this area. They have to do it in orders for hospital. People get confused on that, but.
Okay. So the next thing we're going to discuss is documenting a clinic-administered medication. We call those CAMs. So you can tell that a patient needs a medication to be administered when this icon appears on the schedule next to their name in the meds due column. It looks like a red clock. So what you need to do when you see that is to go into the MAR. And there's always multiple ways to do something in Epic, multiple places to go. I wrote down 2 different options. So the way you can get into the MAR, if you're already on the schedule and you see that little red clock, you can double click on that and it will automatically open you into the MAR. And all those medications that are scheduled to be administered will show up on the MAR. Or if you're in the patient's chart, you can just open up the MAR. If you've pinned it on the side on your activity tabs, or you can go to the More button and find your MAR. So once you go to the MAR, you will see the medication that needs to be administered, and it will have a blue bar. We'll have a blue bar, and it tells when it's due. There's also a button underneath that says New Administration. Do not click that button. You want to click on the blue bar. So make sure you're clicking on the blue bar to administer that medication. Do not click the New Administration button. Okay, so once you've clicked that blue bar, the information will pull up that you need to document. So you need to enter any of the required information. I think it makes you document a site, the NDC number, and the lot number. And if the patient brought the medication with them, you need to just omit the NDC and select the patient supplied checkbox. I don't know if you can see it down here. It's kind of small on this screenshot. But there is a box there that you can check. So once you're done documenting that information, you'll just click the Accept button in the bottom right-hand corner. Okay. Now that blue bar turns into a green bar, and it shows that it's given. Green in Epic eChart usually means green is good. So it will show that it's given, and it will give all the information about that. And I will go into our patient that. Okay, so I'm on my schedule, and my first 3 Fatima patients, they actually have this. So here is that icon I was talking about. So if you just double click on this, it will take you into the MAR. And now I see my blue bar. So I'm going to click on my blue bar to document. And anytime you have these, it looks like stop signs with an exclamation mark in them, those are called red hard stops, and you have to fill them out. So, and this one, actually, throw this in here. Okay. Anytime you see in a search box, if you see the magnifying glass, if you click that, it has options. It's not a free text. So I'm just going to put in some information here. It's obviously not correct. Okay. And once I'm finished, I'm going to click the accept button. And now that blue bar turned green, and it shows that we gave the medication. Okay. Okay, so what questions do we have about CAMs, clinic-administered medications? Have any questions? Nope. Okay. So the next thing we're going to discuss is documenting sample medications. So when the provider orders a sample, you will see a blue dot on the schedule next to the patient's name. So on the visit orders report, and the visit orders report is going to be on that bottom pane that you will see when you single click on a patient. You'll see the sample med under you'll see the picture right here. It's under sample medications needing completion, and that's going to be on the visit orders report. You will click on the blue sample med link. You won't click on the actual sample medication name, because that will just give you more information about the order. So you will click on this sample med hyperlink, and then you will complete the sample med information. So while the provider is going to be the one that gives the sample medication, but you can document in here, and it gives options. You need to enter the lot number, expiration date, manufacturer, NDC. It even asks if a medication information sheet was given to the patient. Once you've entered that information, you will click accept. And also, sample med paper logs need to still be maintained also, in addition to documenting it within eChart. Okay. So that will I'll show you just real quick on our Fred patient. Okay, so if I single click on my patient, I get that bottom report pane. I have a visit orders report. If you do not have that, you can easily get it by searching for it on the right hand side and adding it to there. But once I click on my visit orders and I scroll down, does everyone see the sample medication needing completion? It's the low pressor. So instead of clicking on this med name, I'll click on the sample med, and then I can document the information about the sample. And once finished, I would click accept. So what questions do we have about sample medications?
Is there a way to document multiple lot numbers? Because if you say you give 2 samples, but each of them have a different lot number, you have to go back in and reorder the sample. And if it's the same quantity, it doesn't give you the option to document the sample again. It has to have a different quantity.
There is not currently another option other than reordering it, but we can take that back as a suggestion.
The quantity is still, you give one lot number and another one. If it's the same quantity, then you can't document the lot number.
On the second one, you'd have, you'd have to go back and have it reordered. So if, in our case, we picked, I think, 10 tablets. If you picked 5 from this lot and 5 from the next lot, you'd have to do it twice. I will ask, because they do have a second box next to the NDC, this one, comment, but I don't think that's acceptable enough to maintain everything. The reason for filling in, we call it discrete data in these fields. So let's say a certain lot number was recalled by a company. Epic can run a report real fast. It can tell you exactly what patients, on that report it can have their phone numbers and emails and all the extra information that the system can automatically generate all that for you. So it would have to be in 2 separate incidences, but I'll have to take that back to the analysts so they can suggest it to Epic for more than one. Very good question.
And would you talk to just a minute about handing the medications while we've got everybody here, handing sample medications to patients?
Sample medications under federal law, I think, to be honest with you. We are not within any nursing, MA, credentialing allowed to dispense medication. We can administer, but we can't dispense. So if I have samples in my cabinet and I go to get them for the patient, the physician is the one to give them to the patient. So he can order them, and he can order 10, but you may only have 5, and you'd have to fix it in the system, and he can go back and change whatever, but it's the provider that is supposed to hand them out. Unless you have a pharmacist working in your area. Pharmacists can hand them out.
Also, the samples have to have the directions on them about how to take them as well.
Yes.
Just FYI.
And in all of this, in their AVS, it should print out as well, but you should give them, if the samples came with the packet information, give them that packet information. If not, you can also go back in their AVS under the patient instructions and type the name of the medication in there, and it will pull up all that information for them. So you don't have to go through and tell them every side effect, everything that the patient needs to know. Did that answer your question, Sandra? Okay. Thank you.
Okay, so now we're going to discuss documenting an immunization. So in order to document an immunization, you'll have to open the immunizations activity. I'm sure a lot of you guys have starred that as one of your favorites if you give immunizations often in your office. But 2 different ways that we've listed that you can open the immunizations activity. So from the schedule, you can select a patient and single click on them and get that bottom report pane and click on the visit orders report, just like we did for the sample med. Then you'll see the administer button next, or it's actually a hyperlink next to the order. Or if you're in a patient's chart, you can just open the immunizations activity and click the administer button next to the immunization. So once you click that administer button, and you'll have to enter all the details, and you can see a screenshot down here, all of the different information it wants you to enter. Once you're finished, you can click accept. If you're interrupted while entering this information, there is an option to choose accept as incomplete to save what you've entered, and you can finish it later. But if you've added all that information, then click the accept button and it will save. Okay? So let me show real quick on our another Fatima patient. Oh, there we go. Okay. Okay, so it's only been. Sorry, we have a lot of Fatima patients. It's a wound care one. Oh. Oh, there it is. There she is. Okay. So you'll notice I'm in the visit orders report again, and under procedures order this encounter, you'll see that the Tdap vaccination is listed. we'll click the Administer button. Once you click that Administer button, it takes you into the immunizations activity. Look towards the top because that is going to be where your incomplete administration is. But below that is going to be the history of administrations. So if you click the Administer button next to the immunization, it will show this screen and you will have to enter all of the required fields. Just going to throw some stuff in there for now. And there are also questions that can be addressed, and there's also room for a comment with a little sheet of paper. So there is a accept as incomplete button if you need it, but you will just accept when finished, and that will then go down to the administration history, and you can view it, of course, by clicking on it. So what questions do you guys have? That's all we had for you today. So do we have any additional questions? Does everyone feel comfortable documenting this information? I know you've probably been documenting it for a while, but okay.
Under reconciling medications, there's a lot of times where a patient will see another provider and they give like steroid injections ever so often. So it's listed on their medication list multiple times. Even though it's just like a one-time, it's not a recurring order. Is it okay to remove those since it's on there like 5, 6, 7 times?
We'll get Mary Ann to give a
And I don't have an official answer for you. It's going to depend on your physician preference. If your provider's telling you to remove them, Epic's kind of looking at that because we've had that same complaint. Your patients that go and get their joint injections and whatever, it shows as a continual. But some of the doctors want to see that, you know, they just recently had a shot. So again, I don't have the official answer on that one. But if there's multiples on there, you're probably pretty safe in removing the older ones, but keep the recent ones on. Hold on, one question. We got the microphone. Down here in front. Down here. Okay.
I've had a few times where I go to reconcile the medications and there are several from a particular office. It's the same office every time, and there are like 10 different medications, and the patient's like, I don't know what this is. Like, they're all totally not their medications. And I make sure that I have the right patient, and they're like, yes, that's me.
And you're not talking about from an outside resource? You're
Yes, from an outside resource that I
Okay.
have to reconcile. Now, I usually just click off of them, but do you think that something further needs to be addressed to
You
see
may
if
need to-
there's an insurance issue going on in the background, like someone's filing something under the wrong patient? You know, because it's the same place that does it, and from what I understand, they're not in business anymore, so that's what's confusing.
And that might be something you need to report to your
And I've
practice
mentioned it
manager to do an e-safe.
Yes, because I've mentioned
check
it
into it.
on multiple times, and they're kind of like, well, you've deleted it off, so it's not on the patient's record, and I'm like, but,
So some of those, as patients go doctor shopping, as we used to call it, so they might think, well, if I go to CVS with this doctor's prescription and I go to Walgreens with this one, the system that we have combines all of that, so it's pulling all that information through SureScripts, coming back in from those pharmacies themselves. So that should be reportable, I would think. And if, you can always put in an e-safe, the occurrence report. You can also call the compliance line. You can do the compliance line anonymously if you need to, if you think it's something you want to address. Okay, I mean, without looking at the instance, we can't tell for sure, but if it sounds like that to you, it probably sounds like that to everybody else, and I would report it.
Would you ask the other campuses if they have any questions?
Does anybody from the other campuses have any questions? East, north, anybody? Bledsoe? Hello out there. You have to unmute if you're talking. You had very good questions though today, thank you.
They were very good questions. I did want to ask you, and you can come to me individually. You can come to me individually if you'd like. But I do want to know, are things like this helpful? Perhaps this was not helpful to you today, I don't know. But are things like this helpful? And if so, I really need to know what else you need. I just recognize the fact that there was a large clinical population that we were not giving any type of continuing education training on. And so that's why we're having these now. I just need suggestions though. So please be free. Yeah, you have to. Okay, lab orders and lab orders placed for future collections. Can you put that on your list,
We can.
Mary Ann?
Yes, we will.
And we'll address that. That's great. What we find too is there's inconsistency in documentation in Epic. So that's the other thing, since you guys do so much of it, that we want to make sure that everybody is consistent as possible.
And the other thing too, while we're in this kind of a forum, if you have something that works super, super well for you, that you might want to share to somebody else, because again, you're the ones out there doing it every day. Cassidy and I know how the system's supposed to work, but sometimes what we train eventually gets changed down the line and somebody forgets to tell us. We're the last to know sometimes. So you let us know what is working really well, but what's not working so well and we need to fix.
I don't know if it's possible with the lab orders, especially with the like LabCorp we use a lot, if it's possible to correlate the actual lab test with the actual order number from LabCorp, because it's kind of hard to differentiate sometimes if you're actually ordering the correct test.
I understand, and part of that issue is there's thousands and thousands of labs out there, and when we first started, we also used Quest as an outpatient lab, and our SunQuest here we used, and all the numbers didn't always be the same. And then LabCorp sends things to, believe it or not, to SunQuest. So things get very confusing in the lab world. So what we think would be an easy fix is not an easy fix for them. So if you had for instance, a CBC, we think a CBC is real easy to order. It's not. There's about 7 choices in there for CBCs. So your providers have to have the correct one on their preference list in order for it to populate, or they go into the main system and find it each time. So the lab number itself may be different in our system. So unfortunately, they will not match up every lab number. Erlanger wants to know if you put a ticket in for a lab that's not in the system and you use LabCorp, they'd like to know that LabCorp number to enter it. But it has to do with interfaces and all sorts of other things out there in the background that we don't see. But I understand your frustration there. And labs are very confusing, and we'll have a lab session probably in the near future.
All right, anything else before we dismiss? Thank you very much. If you would, put your math problems on the counter there. Be sure your name's on it so we give you credit for it.
Thank you, everybody.
Thank you.